I'm Jamie Hartmann-Boyce. I'm an associate professor within the Center for Evidence-Based Medicine at the Nuffield Department of Primary Care Health Sciences, University of Oxford. So I do research covering a wide range of topics, mainly that focuses in tobacco control, diet and weight management, and long-term conditions. But actually I spend quite a few topics, and the underlying thread that they all have in common is methodologically. So I do a lot of evidence synthesis, complex systematic reviews, and what really brings it all together is that what I like to do is go out and do work that's going to help inform policy. Recently, I've had the pleasure of leading quite a few research projects. One of the really big ones we did was looking at behavioral interventions to help people quit smoking. We did an overview of reviews as well as a component network meta-analysis where we brought together data from over 300 trials and looked at what worked best to help people quit smoking when we looked at behavioral techniques and support, and that ended up informing the way that people are trained in this country to deliver that support. I also do a lot of work around vaping or e-cigarettes that informs national and international guidelines. That work is funded by Cancer Research UK and includes a living systematic review. And at the start of COVID, I began some work looking at the impact of infection with SARS-CoV-2 as well as disruptions caused by the pandemic on people with long-term conditions, particularly diabetes, and I do that work with the World Health Organization. All MSc and DPhil students will be assigned a supervisor who's there as a point of contact throughout your studies to help shape your plans and advise on your training needs. I've had the pleasure of supervising quite a few projects over the years. Recently, one of my MSc students won a prize for the best dissertation in her year. That was looking at attitudes around use of hormonal contraception in women in Germany, and that's also just been published as an academic paper as well. In terms of my DPhil students, they span quite a few areas, so I supervise multiple students within the space of tobacco control and within weight management, but I also do kind of act as a third supervisor on projects to help support the evidence synthesis components of those, and that can be in really any topic.